Much. So our next speaker is Sonia Mirza, who is a student at Ontario Tech University in Oshawa, Ontario, and the proud recipient of a 2026 CBR Travel Award. She'll be speaking to us today about the association between anemia and dementia. Sonia, thank you very much for making the long trip.
Hello, everyone. Thank you again very much for this opportunity. It is an honor to be able to present at this year's symposium. So my name is Sonia Mirza. I am a Master's of Health Sciences candidate at Ontario Tech, and yes, I am coming from Oshawa, if that means anything to anyone in the room. I'm here today to present my work on the relationship between anemia and dementia, so examining links on anemia and dementia in adults. This is a tertiary hospital-based cross-sectional study, and it's also at the cross-section of my supervisors, Dr. Syed Qadri, who is a hematologist and adjunct scientist with Canadian Blood Services, and Dr. Winnie Sun, who is the head of the Research and Dementia Department at Ontario Shores. So it's really a tribute to the two of them. Now, without further ado, let's get into the rationale behind why this work was even done. So as it's probably not a surprise to anyone in the room, but our population is aging, and it's aging quite rapidly. Within 25 years, we are expecting our population of older adults to double to 2 billion people. And with that, we expect to see a higher rates of comorbidities, higher diseases, and just an overall decreased quality of life. Now, one of the comorbidities that is increasing, and it is a public health challenge, is dementia, which is a neurocognitive disorder. Now, in Canada alone, we're expecting that over 6 million people will either live with, develop, or die from dementia within a 30-year period. That is a significant amount of our population that the disorder is touching. Now, because dementia at the time has no known cure, one of the key branches of priority is to look at the room for prevention and delay. Now, the Lancet Commission in 2024 released some modifiable risk factors that can be assessed to help prevent the onset of dementia. Now, some of these risk factors that have come up are also chronic disorders, so things like depression, diabetes, and hypertension as well. Now, another emerging risk factor is anemia, which is a blood disorder. So anemia is a huge global health challenge as well, and in Canada, it's very overlooked, even though it affects over 2 million people. And it's also associated with the pathophysiology of several systemic diseases. And so because of that, and because of the supposed link with cognitive impairment, we wanted to assess this a little bit deeper because the relationship is a little fuzzy. The studies that have been done on this relationship are a little bit unsure about the causality and sex-based differences. So what does anemia and dementia look like in people, in males or in females? And another thing is that anemia and dementia types are often grouped, which, as we know, there are several types of anemia, there are several types of dementia. So doing that is not really fair to assessing the mechanisms that are associated between the two. And lastly, there is a limited focus on comorbidities, which again limits the clinical applicability. So to address this, we did a cross-sectional study with the objectives of determining the proportion of anemia among adults with dementia at a hospital titled Lakeridge Health. And we also wanted to assess the characteristics of people with and without anemia in the sample, so really just understanding what these profiles look like. So in order to do this, we did a chart review, and the years that this span was 2022 to 2025. And so just as a very high-level overview here, we looked at all of the dementia diagnoses within this time frame, and we looked at all the people that had blood work. Now, from those people, we excluded anyone that had multiple visits or multiple blood draws, and so we just kept the first one. Ultimately, we were left with 789 unique patients and unique patient charts. And at the bottom of the screen here, you can see some of the variables specifically that we looked at, but there was all of the things that I have touched on. Ultimately, what did we find? So we found a considerably high prevalence of anemia among this sample. So 44% of those with dementia also had anemia. And this might be a surprise to some of you, but the risk was actually higher in males. So the ratio of anemia was actually a lot higher in males than females, so almost 50% higher. So this was an interesting relationship and an interesting finding. An age analysis showed that there wasn't a strong relationship with just age and just hemoglobin, suggesting that there are other things involved as well. And comorbidity analysis revealed a very high prevalence of multimorbidities, so 2 or more disorders among this sample. So about 88% of them had 2 or more disorders. Now, I want to also mention, and this might explain some of the findings that we have about males, is that all of the comorbidities that we assessed were consistently higher in males with anemia compared to females with anemia or compared to males without anemia. So consistently higher in males with anemia. So making sense of this a little bit more. So we did find a high prevalence of anemia, yes. But one other thing that we found is that there was a very, very low diagnosis rate. So only 2% of these people that classified as having anemia were actually diagnosed with anemia or had that diagnosis in their file. So that means that very likely than not, anemia is not being considered as part of their treatment plan, as part of their care plan, which is a huge gap. Now, with this higher risk in males and seeing the comorbidities that might be involved, we do have some clinical areas that we can assess. So it gives some indication for screening and people that we can really be targeting. But the limitations of this study are, of course, that because of its cross-sectional nature, we still can't get that causation piece. So we really want to look into more cohort studies in the future. And this might not be a completely representative sample of Durham, even though we did try. Lakeridge Health is a great hospital, and it also spans several of the cities in Durham region, which is in southern Ontario. And it is a very rapidly growing community, I think the fastest growing in Canada. It's very diverse, but given that it is still a hospital-based study, it might not be truly representative. And lastly, the comorbidities that were included in patient charts are not necessarily the ones that are, that they are the most relevant to their current visit, and they may have carried over from a previous visit. So we weren't really able to assess that temporal nature. So this was the first Canadian study, to our knowledge, to assess this relationship. If you find out that it's not, please tell me after my defense. And because this was a cross-sectional study and we did use hospital data, we were able to look at some of the sex-based differences. We were able to stratify a little bit deeper by age, as this was one of the things that was brought up in literature. So really looked into every 10 years, what was the anemia proportions like. And then, of course, we explored the potential mechanisms involved. So as mentioned, we would like to see some larger scale studies, especially cohort, and really look at other things that might be involved, so race and ethnicity, and also look at the direct correlation between the severity of dementia and the severity of anemia. And lastly, I will leave you with this question. When our organ systems are so intertwined, why shouldn't our research be as well? Thank you very much for your time, and I'm happy to take any questions.
Hi, thanks very much for that. So one question is, how could one establish causation? Or how could one approach that?
No, that's a good question. One of the studies that has been done to try and address this was a retrospective cohort study. So this was in the UK. So they tracked people with anemia and then looked at their dementia outcomes over time. What we would like to do is see a perhaps more longitudinal studies that are forward-facing. But the problem with that is that we don't have time. This is a very emerging issue. So I think a lot of the studies will have to be on that retrospective end, but looking at people with anemia and then following up over time what their characteristics are like. There is a national database called the Compass ND, which kind of does this perfectly. So that might be one of our future paths. Yeah, thank you.
Thanks, Sonia. Great study, very interesting. Just a couple of ideas, maybe nutritional status should be taken into account. Another thing is, I'm just thinking that how hypertension or diabetes can lead to anemia, kidney impairment for sure. But you might need 2 levels of creatinine, because creatinine represents kidney function, but one time point might not be enough because it could be, elevated due to hydration status or whatever. If you can look into your data set, that will explain the situation better. Because I would assume that severe dementia, maybe they skipped a meal, they forgot to eat, or things like that. Yeah, thank you.
No, that's a great point. Looking into that is definitely something we want to do. I think this is just a very foundational kind of pilot level study. But in terms of diabetes, I guess one of the things that we are expecting is that anemia exacerbates rather than just directly causes. So whether it's anemia and then diabetes and then cognitive impairment, or it's diabetes and then anemia. So really looking into that. But that's a great point. Thank you. The nutritional point.
I guess after you defend, and only do this after you defend, but you could go to look at the SCANDAT database, maybe as part of your PhD, and look at that retrospective database in Scandinavia and see if you could see a linkage, because it's a very broad, multi-decade database that wouldn't possibly link to dementia. They do link to CNS diseases. You could probably match that to some variables like anemia.
Thank you. It's called SCANDAT, you said? Awesome, thank you. No, not now. Thank you, yes.
Thank you very much. Very nice talk. I have a question thinking about anemia and somehow lack of oxygen can be due to this anemia, and such the brain will be less oxygenated. Can you check with your study some of this parameter too?
No, that's a good question. You're talking about like the hypoxia side of things, right? Yeah, that's one of the mechanisms that we are looking into. Unfortunately, we are just a little bit limited in the variables that we are able to assess, just because it is a full chart review. So a lot of it is just directly clinical at the time, the things that were taken. But yes, hypoxia has been one of the proposed mechanisms for why we are seeing cognitive impairment in people with anemia. Thank you.
Thank you.
Thank you.